Let's go ahead and begin. I do want to say that this is a public hearing. It is being transcribed. It is being videoed. And we do have news organizations here as well. So all of this is totally transparent and on the record. First speaker, Joe Marchionne.
It's Massey.
Marchionne.
And I thank you, Commissioner, for having this hearing today. Fellow panelists, want you to know that this message was approved by me and not by Wellmont or Mountain States. And I'm here to speak in favor of the merger. I'm going to blow out 5 minutes, so bear with me. I was asked in about, I think, 1994 to serve on the Bristol Regional Medical Center Board. And shortly after that, we merged in 1996, Bristol Regional and Holston Valley. I served on the board during that period of time, the merger and the first few years. I served as chairman of Wellmont, the second chairman, in 2000, 2002. We learned a lot of things during that merger. We had public hearings locally, not sanctioned by Nashville or Washington, and we thought we understood the concerns of the people of the area. People are adverse to change, as you probably know, and sometimes that comes out during these merger conversations or proposed mergers. This time we're hearing less of it than we did for the two major hospitals in Sullivan County's merger. We heard everything from, we're going to lose our jobs. We worked for Wellmont at that time as Bristol Regional or Holston Valley. We're going to lose our doctors. It's going to cost us more. If this thing goes through, they'll shut down Bristol Regional Medical Center. We won't even have a hospital here. We went through all of that, and 20 years later, I stand before you today and tell you that none of that happened. We've got more employees now, Mountain States, Bristol Regional, than previously. We've got a better health care system today than we did before, with individual hospitals who had to stand on their own merits. We've seen during this period of time that oftentimes one hospital, it can be a large hospital, it can be Holston Valley, it can be Bristol Regional, or it can be Lonesome Pine, or it can be Hawkins County. They have up and down times, and other hospitals might not have up and down times at the same time. So they support each other when they're merged together. That's been the strength of the merger. But we see a higher quality of health care today than we ever have in the past. I see parallels between what's proposed now, and I'm not on the hospital board any longer, have not been since 2004, have nothing to do with either hospital system other than I'm on one committee for Wellmont. But I see parallels as to what's happening at the present time to what we went through before, even though it was hospital. We had a later merger shortly afterwards with Lonesome Pine, and I fully believe that some of these hospitals that's merged into these two systems over the years would not be in existence today had it not been for the mergers that have taken place over these years. I strongly feel that way. The present process that you've gone through, dictated by law, has been wonderful, because these questions should be answered before the merger takes place. And I think you've done that. Oh my goodness. I was astounded this week when I picked up the local paper and saw the FTC stuck their nose under the tent on Monday night. I've even gone so far as to read 123 pages that they have in their report, staff report. And I see that report based on one attachment. There are 3 attachments to the report. I can't finish it, I'm sorry. I think I've got something to say.
I'll give you a little bit of extra time, so
Yeah, I do.
go ahead.
If you can grant it.
Go ahead, sir, yes.
Okay, thank you. In that report, there are 3 attachments. 2 of them are generally anti-merger for healthcare systems. And the whole report from the very beginning seems to be anti-merger. That 3rd attachment is from Anthem. Anthem, as you know, has just been refused merger by the FTC. And it appears, since it was addressed only to Virginia, not to Tennessee, that, and Anthem serves in Virginia, that they were attempting to solve a problem. They had prevented them from merger, so now we're not going to let any hospitals merge. So every time a hospital merger comes up, or a system merger comes up, they attempt to shut it down. That is the whole thrust of the 123 pages that they said they worked on over a year, which is, I cannot believe, but that's bureaucracy, I guess.
So thank you very much, Mr. Marchionne. We'll bring you back up at the end of the session. Thank you, sir. The next speaker is Jeffrey Huntemann.
What we've been concerned about is we are 100% behind the merger of the hospitals and the physician practices. Where our concern lies is with ancillary services. As you're bringing these organizations together, which is going to be a huge benefit for the community and for the region, you are bringing together into a single referral source. As we are going to have some of our residents come to Tennessee, we want to make sure that there's an open and fair and equal process for getting those patients to ancillary services. Ancillary services, as you well know, with healthcare is going to become a crucial part of the success of healthcare in the future as they're trying to discharge patients into the home where there is better benefit for those people. So we're asking both Tennessee and Virginia to consider in this process that there are stipulations within the COPA that make sure that Mountain States or the new ballot healthcare has the right format to have open access to a very vibrant market for ancillary services. Some of our services that we're concerned about would be home nursing, durable medical equipment, retail pharmacy, long-term care pharmacies. We also have assisted livings. We have ambulance services. We're servicing both states and people in those states, but our base of operations are in Virginia. But it's crucial that the people that are discharging these patients are open and have access to making sure that there is clear choice for any of the patients that are being discharged. So we're 100% behind it. As a former CFO for Mountain States Health Alliance, I agree and I understand and I support the merger of the hospitals. We just want to make sure that the ancillary services that have a current vibrant market of competitors remain that way. So I thank you for your time.
Thank you very much, Mr. Huntemann. Mike Stallings.
Commissioner, panelists, thank you for the opportunity to be able to address you this evening. My name is Mike Stallings, and I'm here to speak on behalf of the merger. I'm the Vice President of Human Resources at Electromechanical Corporation here in Bristol, Virginia. EMC is a privately held, family-owned business that's been a part of our Bristol community for over 58 years. We currently employ about 500 associates in the Bristol area, and we're a manufacturer of electrical distribution equipment. From our base here in Bristol, we serve a full domestic market as well as an international market. We understand that having a world-class medical system is vital to our success. It's vital to our success from a recruiting perspective, from a retention perspective, if we want to develop and maintain a world-class workforce to be able to compete in today's environment. Our medical plan is, we have a self-insured plan. We have a very traditional PCP product that's coupled with a flexible spending account. We have a consumer-driven plan that is coupled with an HSA. And I would tell you that our medical spend for our company is a significant expenditure. And as a result of that, we work very diligently to be able to manage it and to be able to manage it strategically. We believe that a medical plan, we believe that health care is a lot more than clinical care. We believe that there are at least 5 significant components that we need to manage to be successful in our health care. And that's having an accessible, high quality, and affordable provider network, having a broad-based network system, having a very effective disease management program, as well as an effective wellness program, and having, I guess, what I would call effective consumer tools to equip our associates to be able to become effective shoppers for health care, if you would. We have a vested interest, and our associates have a vested interest in the outcome of this merger. We've had the opportunity to be able to sit across the table from both Wellmont and Mountain States and to be able to work together to successfully put programs and plans in place that will benefit our associates. We believe that this merger will benefit our company, our associates, as well as the community significantly. As I look at the population, as I look at our community, as I look, and really when I do that, I see a reflection of our workforce. And we know that our region faces challenges that are similar to those that are being faced on a national scale. The cost of health care is increasing at a rate that's an unsustainable rate. You know, it can't just continue, and it has to be addressed. So we believe that it has to be addressed from a progressive and a creative management perspective. It's very difficult to work in the regulatory environment that a medical system has to work in. Nevertheless, that's an obstacle to overcome, not an obstacle to stop progress. From a population perspective, I believe that our community probably reflects what the statistics that the CDC would share. They would say that over 80% of medical costs in our country are driven by chronic diseases, and a significant portion of those would be preventable chronic diseases. Thank you. So I believe that it takes a multi-dimensional approach to healthcare for our area. I believe it needs to be inclusive of partners. I believe that both of these medical systems have proven and would continue to prove as one to be a dynamic partner for our company and companies like ours and our community to be able to address our healthcare needs. I believe that local management is critical and essential. I believe that's one of the most substantial and significant benefits to the program. I believe it ensures a robust presence of healthcare services in our community with known partners. It positions our health system to come together with our community and our employers in our community to develop effective healthcare strategies to make a difference in the lives of the folks in our community. As I mentioned, we've had the opportunity to, wrapping up, we've had the opportunity to be able to experience it firsthand. We believe it can be even better. We believe that this merger positions our company and our community to be more effective in attacking healthcare today. And make no mistake about it, the challenge will be great. Systems across the country, all across America, are facing the challenge of rising costs and healthcare management. I believe that this system, that this merger would provide us a very well-equipped partner to be able to successfully attack and win that battle.
And thank you, Mr. Stallings. And one thing I should mention, if anyone has a written statement they would like to submit as part of the record, please hand that to us or email it to us. We'll be happy to have that entered. And we'll bring you back up after Mr.
That was good.
Massey.
Thank you for your time and your consideration.
Thank you. Helen Scott.
Hello, I'm Helen Scott. I'm the Executive Director of Healing Hands Health Center here in Bristol. Hello. Thank you for visiting our clinic not long ago. I'm here to speak in favor of the merger, and I'm here representing the uninsured of not only the greater Bristol community, but also Northeast Tennessee and Southwest Virginia. We expanded last year to help the uninsured. So Healing Hands is a charitable health clinic. We have provided about 70,000 patient visits to the uninsured, and we've provided about $25 million worth of free medications, which everybody knows how expensive that is. We provide medical, dental, chiropractic, eye care, counseling, and dental has really been the greatest need, and we have done a lot to increase help for dental patients, the uninsured dental patients. We have tremendous partnerships. ETSU, Dental Hygiene School, has partnered with us for 15 years. The University of Tennessee Dental School in Memphis sends their dental students up here to rotate. 4 come at a time. But our greatest partnership has been with Wellmont. We have been a partner with Wellmont since our beginning, so that's 19 years. Bristol Regional Medical Center in particular. So we would not be as far as we are without the hospital system. So we're in favor of the merger. Several reasons. We think it will lower costs to consumers and provide high quality care, and also it'll just keep we will not have an out-of-market acquisition, and that's an area that we are especially interested in because locally we feel like having a local entity support Healing Hands is very, very important. If an out-of-market acquisition happened, I don't know where Healing Hands would be. I frankly don't feel that we would get as much support. So that's one area I wanted to stress. We help people every day who call and say they can't afford the insurance that they have purchased. They didn't understand what a $7,500 deductible was or didn't really understand what they were getting into. So, you know, we just help the uninsured either get insurance that they can afford or try to help them come to Healing Hands and get the care that they need. So we recently invited Tony Keck from Mountain States and Todd Norris from Wellmont to come together and tour, and they came to see our new building. We moved into a 9,600 square foot building a year ago, and they both expressed an interest in wanting to work together to help Healing Hands. So we just feel the merger would be better for our community and better for Healing Hands Health Center. Thank you.
Thank you very much. Karen Raines. You passing? Okay, thank you, Ms. Raines. Dan Pol Gears.
Thank you once again, Commissioner Dr. Dresner, for giving me the opportunity to speak. My name is Dan Pol Gears, P-O-H-L-G-E-E-R-S. I am an independent medical practice consultant. My company is called Sunesis Medical. I do work for several practices here in Northeast Tennessee, but I'm not representing any of those practices this evening. As you know, the Tennessee Department of Health is charged with ensuring that all COPA applications demonstrate clear and convincing evidence of benefits, including but not limited to improvements in population health, access to services, economic advantages to the public, and that the inherent reduction in competition to provide health care and related services will not negatively impact the region or state. That's a heavy burden. And to date, I believe you all are doing a very good job of making sure that that occurs. This is also complicated by multiple factions presenting conflicting arguments that the proposed merger will or will not meet this requirement. In a staff submission to the Southwest Virginia Health Authority, the FTC has concluded that this proposed merger does not meet that requirement. It has concluded that the premise that one or both of the health systems would have to be sold to survive is not accurate. Their analysis documented the financial soundness of both health systems and their ability to continue to prosper independently, which would avoid losing local control. The FTC analysis also notes that Mountain States and Wellmont admit that they would have an 88.4% share of total discharges in their 90% service area. That's a little bit smaller than the footprint that is on some of the documentation that's been presented to the state. That includes the zip codes that comprise the area where 90% of the patients reside that go to these two hospitals. And a 93% share of total discharges in their 75% service area. Again, even smaller area than was originally designed in the COPA application. To the contrary, Wellmont Health Systems and Mountain States Health Alliance, aka Ballad, have maintained that the advantages of the merger far outweigh any disadvantages. They propose that through cost controls, improved efficiencies, and a reduction in duplication of services, that costs will stabilize while maintaining or increasing quality, innovation, and access. Hospital monopolies under state action immunity of antitrust laws pose substantial risk to a community unless the public is protected by comprehensive, vigorous, monitored, and enforced rules of conduct and performance. As stated earlier, to date, the Department of Health has been diligent in its preparation of rules and collection of information. The Tennessee Advisory Group did an excellent job of outlining measures that need to be included in the final COPA. If the DOH disagrees with the FTC assessment and approves the merger, but without the necessary comprehensive and effective oversight, there is a very real risk of doing substantial harm to access, quality, and affordability of care. The DOH should resist any attempt by Ballad to change the rules or limit the oversight. The FTC detailed analysis concluded that the residents of Northeast Tennessee are risking much if this merger is approved. If it is approved, the Tennessee legislature and the agencies involved in monitoring must be and remain vigilant and effective in monitoring and ensuring the benefits actually outweigh any resulting harm to the people who live and work here in our area. Competition improves quality, reduces cost, and spurs innovation in all industries, including healthcare. The state of Tennessee should take steps to ensure that these competitive advantages continue under a state action immunity from antitrust, a CON-free zone, or strong restrictions on Ballad's ability to stop competition is essential if the merger is approved. Otherwise, the power of the monopoly is broadened to control the entire spectrum of healthcare delivery, not just hospital services. Innovations that reduce cost and/or enhance quality will be blocked. Access to improvements in health care will be restricted unless patients are willing to travel outside of the service area. Thank you very much, and thank you for the additional time. I think I got it right on the money.
Thank you very much. Greg Neal.
Good evening, Dr. Dresner. Thank you for being here. And certainly appreciate the diligence that the commission is, that the department is applying toward this very important and complex decision. My name is Greg Neal. I'm the president of Bristol Regional Medical Center. As the city of Bristol's largest employer, Bristol Regional Medical Center takes seriously the trust that the community places in us to deliver on our mission, to provide superior health care with compassion. And we share with leaders from our cities, our civic, business, and service organizations across the communities that we serve, a vision for a healthier tomorrow in East Tennessee and Southwest Virginia. But we understand that on our own, we're incapable of making that vision a reality. It requires an approach that benefits from the synergy of collaboration with others, like-minded organizations across the region. So we're real proud of the many initiatives we have with partnering organizations designed to develop and implement innovative solutions for the betterment of the community. Solutions that not only ensure access to high-quality services that expedite recovery from illness and disease, but ones that actually prevent those encounters from occurring in the first place. One example, just one, is our collaboration right here locally with the school systems in Bristol from both sides of the state line. We call it the Power of Health, and it's a program that's designed to work collaboratively with our school systems to encourage healthy living in our students and their families, and provides preventive screening exams, while also investing financially in the physical education programs in the two school systems. We've seen some great benefits from that. But our experience in these kinds of efforts informs us that the needs are vast and far exceed the ability of us to meet them on our own. The magnitude of the culture and behavioral change that's required absolutely requires unprecedented efforts with far more education and interventions than we have the capacity to make today. And that's another reason our proposed merger with Mountain States Health Alliance is such an attractive option. By combining our resources to serve our region most effectively, we will have a tremendous impact on the health of our region, leading people to live healthier and more productive lives. From my perspective at Bristol Regional, I see every day the unfortunate effect of unhealthy lifestyles in the area we serve. It contributes to an array of conditions that require medical attention for people in the community that could potentially be averted. And that's why I'm really excited by the commitment that our two organizations have made to obligate $75 million in the first 10 years to population health initiatives. We also have the opportunity to favorably impact our area with a commitment to invest at least $140 million over that first 10 years alone for behavioral health needs in our region, for items including community-based mental health services, residential and outpatient recovery programs, and tobacco and substance abuse prevention programs. Like other emergency departments in our region, Bristol Regional Medical Center is routinely holding patients for extensive periods of times, sometimes days, even weeks at a time, who we are not equipped to help, but they have nowhere else to turn while awaiting appropriate placement in mental health services. That's obviously not ideal for the patients who would benefit from receiving comprehensive care intervention as early as possible, and it's not good for our resources to be otherwise unavailable to folks needing access to the services that we do have the expertise to provide. People in our community who have become addicted to drugs often experience consequences to their health that require attention by our medical providers. With additional resources to address addiction, Wellmont and Mountain States will be able to help these individuals recover and proceed with leading a better quality of life. This will not only help them individually, but will reap benefits for their families and our communities. So these are just two broad areas where we can strengthen our region's health care as one organization. But we could go on. There are many, many other ways we can make a difference in people's lives. Differences that can be accomplished with a certificate of public advantage that would enable us to proceed with our merger. And I respectfully encourage you to favorably consider the application. Thank you for your time.
Thank you, Mr. Neal. Is there anyone who hasn't signed up who would like to speak? No? Mr. Marchionne, if you'd like to come back.
Thank you for accommodating someone who speaks slowly, sir.
You're welcome.
I failed to mention that during my 2 years as chairman of the board of Wellmont, we thought we could work cooperatively with Mountain States on some projects, so we met the two boards over several months, realized there were many projects that we could enhance the welfare and the health care of this area with. One of them in particular still sticks out in my mind, and that is a burn center. There's not a burn center in the area. We have one of the largest chemical companies in the United States located here. The reason there's not a burn center, it's not a profit center, as you know. And I don't think either system can afford to carry a burn center. We didn't think so at the time, but we thought collectively that that would be a possibility. There are many other areas that combined we can address healthcare needs more efficiently in this area. If you would permit me, I'll skip back down to the FTC report,
Yes, sir.
Which fascinated me. In that report, they state that roughly 70% of the market is covered by these two systems, 71% if they're combined. The thing that they don't mention is we have individual communities, and Bristol, Wellmont dominates. In Johnson City, Mountain State dominates. And what they say in the report is, well, if one system goes down, all you have to do, patients will shift to the other system. You probably read it, you probably realize they say that. That's very difficult for somebody my age and older, where you're traveling great distances if you have an extended illness. It makes no sense. I think they have in their mind Washington, D.C., where they're located. I think this is bureaucracy at its finest in this report. I think they started out with the intent of denying the merger, and they crafted a report that took over a year, according to them, to prevent the merger. That's the same organization that the same day that the headline was here, there was additional headlines throughout the United States. One of them is 4 states will have one Obamacare insurer. That's the Affordable Health Care Act. That's not ideal, but it's more than that. If you read the article, it could be up to 9. Mississippi had 80% will have one insurer. They didn't count that. Florida's 73% will have one insurer. They didn't count that. So what the report indicates, because Anthem is the attachment that they based it on, appears to be, and Anthem says it will reduce competition and make our premiums go up. Well, I don't think they really care about the premiums. If you read it carefully, it seems they care about the bottom line of Anthem, a public company. In fact, they're not really too concerned about increasing premiums, when in Indiana next year they project Anthem will increase premiums 28.3%. And in Virginia, where they addressed their letter, Anthem will increase premiums next year 15.8%. So I can't see that they're too concerned about premium increases if that's happening inside their system. And in the same day, Bill Clinton slams Obamacare. The last person that you would ever think would say, the people out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world. Well, it's not nearly as crazy as the FTC telling us what's good for us from a health care standpoint, from a community standpoint. Helen Scott said it well. These systems, if they remain locally owned, will support causes in our communities. And our health care will be better because they understand the needs of the community. If this merger does not go through, I have every indication, every belief that we're going to have outsiders owning the systems. And if the headquarters move somewhere else, the contributions, community support move with them. That's much crazier than Bill Clinton's statement. Thank you very much. I appreciate your indulgence with me.
Thank you very much, sir. We appreciate it. Anyone else like to speak? No? Dr. Dresner?
Anyone like a few more minutes before we close? Going once?
Mr. Stallings, you're welcome.
Okay.
Thank you.
Well, let me thank everybody for your comments. Very helpful. I also want to thank my associates, Jeff Ackerman and Allison Roger-Rockman. That's a make good. So once again, thank you for being here. And there'll be, as you know, we've now been in several places, in Blunteville, in Kingsport, in Nashville, today here in Bristol. There'll be one more opportunity for public comment shortly. You can continue to make comments to us online. And again, we encourage active public participation. We appreciate all the comments. We take your input very seriously. It's important. It's important to this community. It's important to the state. Again, we're plowing new ground and setting precedent here, and the Tri-Cities of Tennessee and Virginia are at the center of it. And I want to thank you again for your participation here tonight. And we are closed, and we're off record. Thank you.
Thank you.